Hello, everyone. My name is Karolina Mackiewicz. I'm the Innovation Director at the ECH Alliance, and I'm here now to moderate a discussion with my colleagues coming from the policy, from the healthcare professionals and people engaged in healthcare management to talk about the need for skilling, upskilling, and reskilling of the healthcare professionals. Today, we already had a bit of setting the scene. The keynote speakers told us about how to best fit our systems or prepare our systems for a digital age. We also heard some case studies, and now we would like to talk about how we can really make sure that our healthcare professionals are skilled to embrace this digital solutions, and also how we can use the digital solutions to skill and upskill our healthcare professionals. I'm joined here today by 4 speakers, and I will ask each of them to introduce themselves very shortly. So with me today is Lyudmila Ninov, Program Manager at EMA, Josephine Declay, Policy Officer at European Specialist Nurses Organization, Gianluca Conte, Researcher at IRCCS Politecnico San Donato, and Celine Carrera, Director of Innovation and Transformation at EIT Health. So I would like to ask each of you to give a very short introduction to your perspective. What do you bring to this session today? Let's start from Lyudmila.
Hello, everybody. I hope you can hear me and see me. Lyudmila Ninov from Brussels, based in Brussels, working for European Health Management Association for a year now, leading on the BeWell project. You hear a little bit about this flagship project for us. I'm very excited to be here today with you. I'll be talking about the skills strategy that the project is developing to help upskill and reskill the health and care workforce. And I'll give the floor to the other participants now, but looking forward to the discussion.
Brilliant. And then what about you, Josephine?
So I'm Josephine, critical care nurse and working for SNOS policy officer. So I'm here to give some insight also, like Lyudmila, from the BeWell project that we are part of. And being part of the solution is quite the right approach, I guess. So we'll exchange more on that in the next hour.
Super, thank you so much. Then I pass to Gianluca.
Great, that's my turn. Yes, Gianluca Conte, I am a nurse, so I will be sharing with you the nurse perspective and also the researcher and educator perspective. I'm based in the beautiful Milan in the northern part of Italy, and my field of research is mainly related to digital competence and digital self-efficacy among healthcare professionals. And I'm here as part of ESNO, that is, a part of the BeWell project. And I think that's it.
Yeah, that's good first start. Thank you. And Celine.
Yeah, thank you, Carolina. So Celine Carrera from EIT Health, so the European Institute for Innovation and Technology in Health. And I lead the education, among other activities, but the education pillar at EIT Health. And I'll say a word about how we go about addressing skills gap for healthcare professionals, but all professionals evolving in the health sector. And I hope to showcase with some examples of the projects we fund and help develop collaboratively with stakeholders across Europe.
Perfect. Thank you so much. And I invite all our participants, our audience, to share some comments or questions to the speakers with us. But first, to also give us a bit of introduction, I will pass to Lyudmila, who is the manager of the coordinator of the BeWell project mentioned here already. The BeWell project aim is to develop the first ever strategy for the digital and green skills for healthcare workforce. Let's hear what actually is coming out. The first draft of the strategy is now under consultation. So Ludmil, tell us what are actually the key elements of the strategy, what came out so far, and what is being recommended.
Thank you very much, Carolina. As I said, a pleasure to be here. Correct. The strategy is already available. It's on our website, and I believe it will be posted in the chat. It was developed last year in June, published in June, and it was co-designed, co-developed with everybody within the BeWell project. And really, the BeWell project is developing quite a lot of different outputs, but one of the main, if not the main output, is the strategy. The strategy has certain recommendations for local, regional, national, and European level. But before I go into that, just 1 minute to explain a little bit about the fact that we are facing now digitalization of green and greening of healthcare. These are two processes. We call them the twin transition to digital and green, and these processes are here to stay. The objective of the strategy and of BeWell is really to prepare the health and care workforce for current challenges, but also these two transitions into digital and green, as I already mentioned. Just to be clear, when we talk about green, we talk about sustainable healthcare, sustainability in healthcare. This is quite important. We know that according to estimates, we have 15 million people working in health occupations, and we need to make sure that these 15 million people are prepared for current and future challenges. Now, we've done the strategy. Carolina mentioned it's out there for consultation. I'll pay some attention towards the end of my speech on that. But what you need to know is we put the knowledge that we had in the first 2 years of the project, and what came out on this first draft, as Carolina mentioned, are several recommendations. So if we start from local and regional level, so we talk about local governments, we talk about agencies, also education and training providers, we are recommending that the digital and green upskilling and reskilling becomes a priority. And we are also recommending that they put digital and green upskilling and reskilling into their operational plans. We also recommend, as they're close to the people, we recommend that the local and regional level listens to the communities and make sure that the input from the community is well taken on board. And we are also recommending that these, let's say, foundational level, it brings up the certain policies that have to happen on national and respectively European level. When it comes to the national level, so this is the member states, this is the ministries, this is the agencies and other national authorities, we're recommending that first of all, the uptake of digital and green skills strategy is again a priority. And also, we would like the involvement of different stakeholders on national level to be from multidisciplinary approach and multi-professional approach as well. These are quite important. Of course, the national level should connect with the European level when it comes to securing funding for upskilling and reskilling programs and projects. And as a final point, this robust and strong strategy, and more specifically the second version of it, we are recommending to be implemented into the national strategies when it comes to health, education, and employment. Finally, European level. So we're talking about, of course, some recommendations for the European Commission, but also other EU bodies and agencies that work with the European Commission. So, of course, the European institutions should continue to promote the digital and green skills agenda. This is for sure. Projects like BeWell, but some other projects as well, are a great start. The European institutions should also collaborate with other international organizations like WHO or OECD as well, and they should join forces in order to become more robust and to make green and digital upskilling and reskilling a priority, a must, as I already mentioned. And of course, the European level should give guidance when it comes to the implementation of good practices in upskilling and reskilling. And now, in terms of the online public consultation, so you already heard how we developed the strategy. You heard the 3 levels and recommendations. We want to hear the people. So we want to hear and gather as many perspectives as possible on this robust document. So that's why in June we launched an online public consultation. It's available on the BeWell website. It's in 9 European languages. You have the strategy in 9 European languages. You have also a summary version of 5 pages. But the idea here is in meetings like that, in meeting other stakeholders to get their perspective, to get their views on the strategy, on the recommendations, in order to make it a even more solid, bulletproof, easy to implement document across the 3 levels. Because end of the day, BeWell and the strategy wants to prepare the health workforce of the future, but also to manage and handle current challenges and difficulties. With that, I would like to close here. Of course, throughout the session, I'm more than happy to answer questions, but I think this is a good initial laying the foundation of the discussion. Thank you.
Indeed. Thank you so much, Ludmil, for this, and of course for all the work around the strategy. Actually, just before our session, I noticed that the Regional Committee for Europe, so the WHO Euro, they met last week and in Copenhagen, and there was a framework for resilient and sustainable health systems 2025-2030 released. And the skills in the whole document, the skills is mentioned only once. Even if on the very first page we read about the healthcare workforce crisis, and it also says that the delivery of healthcare services depend on the skills of the healthcare professionals, but there is no word about the skilling, reskilling. So I think we have to also connect with as you said, with WHO, and also bring this high on the European agenda. But with this, actually, I wanted to pass my first question to Josephine as the representative of the nursing community, of course, coming from ESNO. How do you think we can ensure that actually the nursing workforce is prepared to meet the demands of this digital healthcare and benefits from the strategies and the work like BeWell? There is healthcare workforce, stress, demands, fatigue, mental health burden, and yet there is this like understanding that we need to now skill, reskill, upskill healthcare workforce to be able to embrace the digital transition.
I think it's quite a challenge. So whole goal is like this project, this whole being part of the solution is a key element. We think that it's important to invest in education and to develop with that upskilling and give the school, nursing school, digital skills. So go with some computers and stuff like that. So that can really give the student, the next nurse, the knowledge on the digital and on the green skills. And that really focus on the targeted education. So we are connected to reality. Also, one key thing is collaborate with other partners, like breaking silos. Go to the developers, go to other industry, go to the people that are doing the product with you, and things, so that we can have our say in the development of the solution. So it's also a key element, and it's quite complex to actually do it. And within ESNO, we have a digital health working group, and that's where we really want nurses to have a voice and to make the change into the courses and our curriculum, so that we want to design the solution with the industry, with the healthcare worker, with everyone that is concerned. So
okay,
that's our idea.
Thank you. And Gianluca, you are a researcher, you are a nurse, you are an educator. Can we also, do you see that we can also use the digital tools like AI as tools to actually enhance the skills of healthcare professionals rather than replacing them? And is there like any specific roles that AI can play in upskilling and reskilling programs of healthcare professionals?
What a question. Well, definitely. The thing is that when you know the literature that is behind digital solutions and mainly AI in nursing and healthcare professions, the real question here is uh, how this peculiar technology can be used as a practical tool. What we know to date is that this particular tool can do three main things. The first one is image recognition. The second one is identification of complex patterns. And the third one is to provide information using natural language. And myself and other researchers too in the literature see great potential in these three pillars. Um, so the key here is that it's not a matter of replacing the nurse. That's a thing that stems even from the Industrial Revolution. I think we are safe, and I think that we can embrace and and do the right things in this regard. You need to consider technology and mainly AI as a co-pilot in the work of the healthcare professional. Again, the concept of the tool, it's just another tool, like the computer was and is a tool, like the phone is a tool, like the EKG and the paper and the pen, they are all tools. The difference is that right now, we know that this is a powerful tool, but we are in the early days, like, I don't know, in the 90s for the internet, and we need to find practical use in everyday tasks. So, from the tool to the task. So, this is definitely a matter of skilling and upskilling. You are all right.
Yeah.
You are it's a matter of skilling because you are creating more time for mentally and socially demanding activities for the nurse, for example. You are helping both the novice professional and the experts, even the experts, because in some tasks we are all humans and humans have flaws. They get tired, they need to sleep, and they have many, many problems. So you are creating time and energy for dialogue and touch and smile and research and education and so on. For now, I think that the recipe is a bit cloudy, but also simple. Let's start with just speaking of AI as researchers, as policymakers, like we are doing today. Um, and we don't need to start from AI for the sake of AI. Let's start from the very foundation of skilling and, of course, upskilling and reskilling. That is digital literacy, self-efficacy, fear, motivation, the actual behaviors, the actual use, the attitudes, and the overall digital competence.
Let me jump here. You said, like, I agree. Like you said, it's yet another tool, and of course, in 2, 3, 4 years, there will be other tools that are coming. There might be some other technological breakthroughs, and we have to, of course, keep updated. So for you, Josephine and Gianluca, thinking from your perspective as healthcare professionals, how can we actually like foster the culture of continuous learning and also make sure that the professionals stay updated? I can imagine that the new student coming to the to the medical university today, who is 20, who is digitally savvy, does not have any issues with this. But then if I think about the nurse somewhere in the provincial town, somewhere in Central Europe, and it's a different starting point. Would you like to comment on that? How to foster the culture of continuous learning, Josephine?
Yeah, of course. I think it goes with accountability also, as trying to get the healthcare workers
Gianluca,
accountable.
can I ask you to mute yourself? I think we have a bit of
I
echo.
don't think it's on my side, but
Okay, there is someone. Okay, go on, Josephine. Thank you.
Sorry. So yeah, it's about people that they know and they are part of their training and they are accountable to have the right course and the right knowledge on the tools they use. Either it's AI or EKG or we don't care, but this is their thing. They know, so they have their ownership of the knowledge. So this is a key element for me. So to achieve it's quite complex, but to enable people to be accountable for their own course and training is essential.
Perfect. Thank you so much. And then I will move to Celine. Celine, you as Director of Innovation and Transformation at EIT Health. EIT Health is financing a lot of different programs to upskill, to invest in the skills of healthcare professionals and also in the skills of the developers, business community. Can you tell us a bit more about how EIT Health is addressing the gap in digital skills among the healthcare workforce? Is there some innovative initiatives that's proven to be effective?
Yes, certainly. And I will echo some of the comments made by the previous speakers. Generally, at EIT Health, when engaging in, well, as you said, funding, education, or training interventions, the first step we go through is what we call skills observatories to understand the exact needs and gaps, what are the barriers to adoption of an innovation, adoption of digital solutions, and so on. So this is the cornerstone that ensures that whatever education comes through is relevant to the learners, who are they, what are their learning needs, and so on. So we have a series of such observatories or needs assessments. We are currently into one with the European Partnership for Personalized Medicine, and we are in charge of the needs assessment. So we engage with learned societies, to understand where they are at with personalized medicine approaches and what are the barriers to adoption. And we go all the way to asking what are the levels of awareness and confidence when engaging with personalized medicine, because this is super important. And from there, we design competency frameworks and curricula. And in the notion of the competency framework, for us, it was really instrumental, because if I take digital skills, so we'll have a competency framework where we'll touch on the technical aspects of the digital, but we'll also touch on the, say, soft or transversal skills. Because when you want to upskill or reskill, then you must support the audience, so healthcare professionals, here with leadership skills, critical thinking, problem solving, design thinking. And here we also have interventions. And that is an answer to your earlier question to Josephine and Gianluca, how to ensure with the fast speed of new technologies, with those skills, then healthcare professionals are equipped to not be taken aback, but react constructively to hear a new technology. So this is a very strong point. We pay very much attention to the formats, as I was saying. So if we have an education intervention on AI in healthcare for busy clinicians who have no time for little family and hobby, you need to be careful of how is that education going to be presented to them. So that's super important. We also go all the way to submitting to UEMS EACCME some of our education interventions for doctors, so that they have the benefits of the credits. Yes, I know UEMS EACCME or accreditors. We also go for national accreditation. So that's on the motivation. We pay, I would say, not enough attention to national language, but we will invest further, because then you can then scale and disseminate further as well. And so I can illustrate with some example, unless we come back later to that, Carolina.
Let's also come back later to that, but
Sure.
what you said at the beginning about also looking into the future prompted me to ask a question to Ludmil. Ludmil, I know that in the BeWell project there was also a work around the new occupations that actually emerging occupations. So we have to also, I think, understand that the healthcare workforce of today and healthcare workforce of in 5 years, 10 years. We will have new occupations. Can you give us a bit of glimpse into that, a bit of comment on this? What those new occupations might be?
Yes, Carolina, this is a question that everybody is very curious about, and everybody is asking quite a lot. In a nutshell, in BeWell we have done a research in the beginning of the project, 2022, and we call it skills intelligence, just to see the skills mismatches, the skills gaps, but also what new emerging occupations will be there in the future. Maybe I can just highlight a few of them. One of the most interesting one perhaps will be around chief information officer or IST operational manager. So this is around digital. We're talking about a risk and quality assurance manager. We're talking about a system analyst. So positions around data privacy, GDPR. Another interesting new occupation would be on a green area, and this is definitely has to do with green skills, and it was around waste management and sustainability of hospitals. So we have developed a series of courses for them as well, alongside the digital and the green training programs. Because as I said in my opening, we need to prepare for this transition. And as you heard, the positions are really around these two topics. I believe that more and more the trend is towards developing courses and programs, educational materials for positions which have to do with security, but also climate change and what we see today with what is going on in the world, and how environment is reacting to our footprint.
Yeah, thanks for this intervention. And this actually brings me to also the comment that on one hand we can say, yes, this is another tool, this is like the natural development in the system, but at the same time we see how much more complex those tools are, and it's not just about teaching the people to use the tool, but also making sure that they understand the all implications around privacy, security, and so on and so forth. So I think this is what makes it also complex, and not as Josephine also said, we need to work with other sectors. I will then let you, Celine, give us an example of the initiative that was effective, and then I see also that we got a question from the audience. So after your short intervention, we will move to that.
I'm happy to. So there will be many examples, but there's one that really comes to mind. So we have a course destined to healthcare professionals. It's called Digital Transformation of Health Institutions. So for healthcare professionals working in a hospital. And so that is what we call a blended learning program. So there's a short asynchronous online module that participants should take before the course. And then the bulk of the course is workplace-based learning. So it happens in the hospital. That allows for multidisciplinary approaches, like were mentioned by Ludmila and Gianluca. And they then engage with the course material on site as a team, taking real life cases to explore here the digital transformation of their health institution. And there's the German trias, the Hospital of German Trias in Pujol in Spain, that are doing great work around that format. And so that's, train the trainer so we can scale and have other hospitals engaging. that works quite well. We have another short course. It's called Data Entrepreneur. It's online, asynchronous. And this is to upskill a healthcare professional around the introduction to machine learning and how to apply it to data, medical data, for better decision making. So here we don't ambition to transform a doctor into a data engineer or AI expert, but to upskill them to that level that they can go back to their IT department, top management, and advocate. So we have here a change agent. They speak the language, if I may say, and they can talk with those teams and say, that's what I need to improve my decision making. We have data, etc., etc. And just a tiny one, last one, where upskilling in digital skills was a fantastic impact. This program is called DGID. It's between an innovation project and education. This team have developed a mobile app to work on the digital literacy of adult citizens with intellectual disability. And during COVID, the impact on that population was disproportionate because they were not connected, not able to use a phone and so on. So that's a collaborative with the healthcare professionals that has allowed to have these citizens with ID more ownership of their health. They can communicate with their medical teams and so on. So here, perfect example as well in the setting involving the doctors and the patient themselves. So, I mean,
I would encourage everyone to visit the EIT Health pages and look for the courses. I know that there is plenty. We have a question coming from Tom, who works for the company that provide the digital products for healthcare providers. And he says that one thing they struggle with when introducing digital products to healthcare organizations is clinicians' buy-in. So a practical example would be that, he gives a practical example of the out-of-control spreadsheet being preferred to a dashboard, which is automatically updated. What are some ways to increase clinician trust when it comes to embracing new technologies, or even old but new to the organization? So how to make sure that the clinicians actually buy in or are like open to test the solution or use the solution. Josephine, Gianluca, I'm looking into your direction. Josephine?
For me, it would be like, don't come to me with a product that's already finished. It shouldn't add more time to my daily practice. It's not because it's new that it's going to be great, but it's not because it's new that it's not useful. So just be aware that it's a new tool, use it, evaluate, and if it's good, you keep it. Otherwise, you throw it. But don't consult the people before. That would be like the thing.
Okay, that's very, very good and very simple advice. And Gianluca, do you want to comment in 1 minute?
Yeah, if I can iterate on that, you need to select the most suitable technologies, but after testing them. So pilot projects are key here. And you need to ensure that during this pilot phase, you respect existing workflows without causing disruption. So I think that merging my suggestions with what Josephine said, this could be a good recipe, to tackle this huge problem. This is a huge problem.
I always say about the example from my mom, who used to work in the hospital in the secretariat, like at the admin staff, and for her, digitalization in healthcare is the biggest nightmare of her life. I think that because the solutions were not finished and they were like not intuitive, and
they are top down.
were actually causing a lot of disruption instead of support and improvement. But there were also old times, so I believe that those solutions are better now. Closing, we have 3 minutes to close, and I would like to hear from each of you, meaning a very short intervention, very short thoughts about when you look into ahead 5 years, what's your vision for the digitally skilled healthcare workforce? How do you see the digitally skilled workforce in 5 years? Just very one sentence. Ludmil?
Yes, for me, what's really important is to continue invest in lifelong learning, continuous professional development, and this is something that will prepare us better for future challenges, but also make our life and workload optimized, and just make sure that we are on the same page as the changing world around us.
Brilliant. Josephine.
I would go for trust the process and like go to the unit, ask them what they want, and work with them, work with the people that actually will use your solution.
Okay. Gianluca?
Yeah, only if we do the right things in research and policy making, I see in 5 years nurses and healthcare professionals that are more aware, that are more able to collaborate, more connect. We need to ensure to demonstrate value to those people. Only doing this we can achieve success in a 5 year time frame.
All right. And what are your thoughts, Celine?
Well, my thought is that in 5 years, the workforce that's going to come on the market will be a different species from us already. And then I would just echo what Gianluca, Josephine said. My word would be design thinking. So really, whatever solutions, even with my daughter, who's a tech person, whatever future technologies, work with the people who will be using. So design from the people and their needs and how they will use.
Thank you all so very much. It was a pleasure to connect with you for this short discussion. I hope it gave all of us a bit of better understanding what we need in terms of skilling, reskilling, and upskilling of healthcare professionals. And for those of you who are listening to us, please take some time and participate in the public consultations of the BeWell project. This way you can really influence some European and processes and make sure that in 5 years, hopefully, we actually have happier and more satisfied, but also better upskill nurses, doctors, and other professions in hospitals and our healthcare providers. Thank you.
Thank you very much.
Yeah.
Thank you. Bye-bye.
Thank you.
It was a pleasure.